Newton-Wellesley Hospital has a long-standing relationship for providing high-quality patient care in a safe environment. Proven Healthcare identified the top 100 hospitals in the nation, and Newton-Wellesley received that notoriety. Secondly, Leapfrog organization, a well-respected quality and safety organization, independently rated Newton-Wellesley at the highest level of their scores for the third year in a row. This all speaks to our commitment to a safe, quality environment for our patients.
Really on a minute-to-minute basis, we're trying to keep in mind what we need to do to keep our patients safe. As far as what sort of tests are we ordering, what medications are we ordering, what are the interactions between those, the use of the electronic record to identify those interactions, make decisions to either adjust what we're treating with or how we're treating before mistakes can be made.
We observe staff members going in and out of the patient room to ensure that they observe correct hand hygiene before and after patient care. We do daily rounds in our unit with the other charge nurses to ensure that we have adequate staffing for the day. We also make sure that the patients go home with all the information they need for their home care.
We have to work with a multidisciplinary team, so I work with doctors, nurses, room service ambassadors, the chefs downstairs, PCAs caring for the patients in their room. All of us have to work together to make sure that we're providing the absolute correct meals for these patients, especially with food allergy kids. A lot of them have life-threatening allergies, so just making sure that the patient and the parent in these cases feels really safe about what they're about to consume.
Our ambassadors who deliver meals to the patients, a big part of their job is just to really make that patient's day when they deliver that meal and just improve the quality of their overall stay.
As a nurse in the prevention center, I spend a lot of time listening, and sometimes when patients come in for a visit, we can have an agenda, but if I listen to the message of the patient, it will sometimes change the direction of the office visit, but we may end up actually accomplishing more.
Sometimes I actually have to interview patients to get more information about medication, and we want to talk to the patient's families and make sure they know how to take care of them with medication therapy.
Quality to patients, to moms and to families really means that they're getting the best possible care.
Safety and satisfaction go hand in hand because I have to first ensure that my patients are safe and that their parents see that they're safe as well. And it is not until I put all the procedures to ensure that it's safe can they really get the full satisfaction.
Quality means taking good care of my patients and making sure that I am up to date on the current task force recommendations for screening and making sure that patients feel that they're well taken care of.
We have to make sure it's the correct patient, so when we walk in we have to do our timeout, verify it's the right patient, it's the right procedure, it's the right side to do the procedure on. Before we ask to see the patients live, after we've reviewed the images and put the interpretation to the system, what I do is, I sort of sound out the patient's name. I look at the paperwork in my hand, I look at the workstation, make sure it is the correct patient.
Our new electronic medical record system that really is helping us to drive quality to an even higher level, helping us to drive new quality initiatives as they come through, as recommendations change. Knowing what we need to be doing it well, and then be willing to be receptive to new methods to improve quality.
I am in charge of your safety, and I'm in charge of your family's safety, and if I see something not working right for you, I'm going to step in and make it happen. When you walk through the door and when you're leaving, there's not one part of your stay here that I'm not going to be on top of and making sure that it's done right. Patient safety is the key to our success.